Welcome to Straight from the Source, a podcast from FMOL Health. Here, healthcare is a verb. It's how we show up every day boldly, joyfully, and with great love. You'll hear real conversations with our experts, the people who healthcare every day. Our goal is simple, to bring you connection, clarity, and context straight from the experts you can trust. Because healthcare isn't just something we provide, it's something we do. Today, we're excited to welcome Dr. Catherine O'Neill, Chief Academic Officer at FMOL Health, Associate Professor at LSU Health Sciences Center, and Chief Medical Advisor for the SEC. Welcome, Dr. O'Neill. We're glad you're here. We're glad to be on LSU's campus, sports podcast studio here. Appreciate you coming on with us.
Absolutely. It's pretty cool.
It really is. Yeah. But before we get into why we're here and the reason why, 20 plus years in medicine, right? I'm like,
you didn't have to say it that way.
You're an associate professor here at LSU, infectious diseases. You're essentially the spokesperson for the state. It felt like during COVID.
For a little while. That's right. That's right.
But more importantly, you have a pet chicken.
I do. Frank.
How's Frank?
Frank is fine. My son has taken over the chore of putting the chickens up at night, and we're holding him to it. And so Frank's had some hairy moments where maybe the chickens weren't actually put up at night, but he's still there. He's a survivor.
Shout out to Frank. I'm happy for Frank.
Yeah, we are too.
This championship health partnership between FMOL Health, Our Lady of the Lake, and LSU is a big deal, right? Let's start big picture. Why is sports medicine an important focus area for FMOL Health right now, and how are we filling that need in our community?
Right. So I think before we get into why it's important to us, let's define sports medicine. Because I think that people think about sports medicine and they think about when I get injured, that's when I think about sports medicine, right? So there's really two kinds of sports medicine doctors. There's a sports medicine doc who starts off in primary care, and they can take care of kids. They can take care of older patients. They can focus on your blood pressure and your diabetes and your desire to continue to perform. And then there are sports medicine orthopedists. Those are surgeons who really see you when you're injured and then try to work on making sure you get back to exactly where you were before you were injured. Well, the reason that distinction is important is because one of the reasons we think sports medicine is so important is because people don't go to the doctor until they're hurt, right? Until they're sick. And most people are hurt before they're sick. So I can tell you I love to garden. I have a chicken named Frank, right? It's several paces to go out to check the chickens in the morning. And at some point or another, my ankle's going to hurt. My knee's going to hurt. Maybe I twist my ankle. You've seen a ton of people who just say, I was doing this thing, and now I can't do it. You're about to run a marathon, which kudos to you. And there are all these little aches and pains that come along in life. Somebody's got to check them out. And if we don't have sports medicine doctors there, then who do they go to? We tell people all the time, hey, we're talking about flu shots or we're talking about prostate cancer screening. See your doctor. But most of the community doesn't have a doctor. And the first time they touch the community is going to be because they don't feel well. And most of the time that's because they hurt. So we need a lot of sports medicine doctors that people feel comfortable go into the doctor and saying, I'm not here talking about blood pressure. I don't want to talk about whether or not I'm going to die or not. I want you to make me feel more comfortable to do the things I want to do. That's why sports medicine is important to everybody. Why is it important to our health system? Because we want patients to feel comfortable seeing a doctor. We want them to be able to say, if I need to see a doctor tomorrow, I can see one. That's called access to care. And we know that when people don't have it, they get sicker. And so we want a gateway that makes people feel comfortable, gives them lots of access, and ultimately makes them as healthy as possible. Because if you're going to have a stretch goal, running a marathon, right, you've got to be healthy for years before that. And how do you keep this community healthy? It's through sports medicine.
Speaking of this community, Louisiana in general, it's a sports state.
Yeah.
I think Baton Rouge is a
100%.
sports town.
Yes.
How has that community energy helped drive the growth of sports medicine here and across our health system?
I think the energy definitely helps drive people. It piques their interest. When we talk to our student athletes, so we had student athletes come to Our Lady of the Lake a couple weeks ago from Southern and from LSU. And, the student athletes are just some of the most motivated people I've ever met. They have a schedule like nobody else's business. We talked about my busy life. I'm nowhere near as busy as a student athlete. And that kind of interest in what they're doing right now ends up becoming an interest in sports medicine. And so the more athletes you have in a place, the more people who are high performing, the more interested they are in saying, how can I keep this up? How can I help other people do this? And so it's a natural evolution to have more people interested in sports medicine. And I think that's why you see we have great athletics for a lot of reasons here, great athletes in the state. And then we have a lot of people interested in sports medicine because they continue to say, man, I just want people to perform at whatever level they're comfortable performing.
Just being around the sport, right? Even when you're not playing, look at me. I want to be around sports. I love LSU. I love the state. Yeah. But just being around sports in that atmosphere just helps. It makes a lot of sense. But the partnership between, again, LSU and Our Lady of the Lake, the largest health investment in this Louisiana's rich history, in my opinion. A few years in now, what makes it so transformational?
Yeah, that investment is, we're here to talk about sports today a little bit, but when we talk about the global partnership, we aren't exactly the healthiest state,
nope.
Right? And we're surrounded by states who are not at the top of the list either. So it's not like we can pull on our partners and say, hey, let's get better. Instead, from within, we have to decide to be better. Sounds a lot like athletics, right? We have to have the motivation, and then we have to have a plan. And if we want this state to be healthier, our plan has to start at the education phase. It can't start at once you're a physician seeing a patient, I'm just going to suddenly make everybody healthier. We really have to get to the nidus of people who don't understand their health. So that's our students. And so we are now running the LSU Student Health Center and their mental health access. And we've seen over the last couple of years that more and more students are seeking care there. We want to teach them about lifelong learning in health. It's not about, hey, my finals are stressful, my stomach's kind of burning, I may have some reflux because I'm drinking too much coffee. At that time that they come in to talk about their stress, it's time to talk about all of the things. Do you have a family history of cancer? Do you have a family history of diabetes? How can I help you be healthier for the rest of your life? So pivotal parts of our partnership, like that Student Health Center, are teaching people to be healthier Louisianians, right? And that's so important. The other huge part of that partnership is that we really haven't tied healthcare to the campus here in a long time. And there are so many students who want to give back. They want to be healthcare providers. They feel that call, like people feel a call to any profession, and we need to tie them in. So I mentioned earlier that the student athletes came to LSU, but throughout the year, we have so many students from around the community who come into the hospital to experience healthcare professions. How do we bring that a little bit closer to campus? You don't have to come to the hospital to figure out what you want to do. We can bring it to campus and show people what a joy it is to practice medicine and hopefully inspire the next generation of healthcare providers.
So as we talked about earlier, I'm preparing for a marathon. I would consider myself a weekend warrior at this point. Mm-hmm. What lessons are you learning from, I guess the hospital or whoever's treating athletes? What lessons are you learning from treating these LSU athletes? I've never played at the collegiate level. I never will. That time has passed. What lessons are you learning from treating these patients that you can kind of migrate to a person like me?
Oh, there's so many. When you find somebody who is functioning at the most elite level, there are 10,000 steps that got them there that can get you there, right? Because your most elite level is just like theirs. It's a journey. And everybody has a journey to finding their top performance. So whether it's running a marathon, which is huge, dude. I mean, most people can't do that, right? So kudos to you. But it's about your mental health, your drive. When you get up in the morning and say, yeah, I'm gonna run 22 miles today. What did you have to put into that preparation, right? It's about preparation. So all of us have gone outside and done something that we probably weren't ready for. I have so many patients who will come into my office and say, my knee hurts. Why does your knee hurt? Well, I decided to paint my house. And it's the on and off the ladder. And then for months after that, they're not as active. So preparing to be active, mentally preparing to do something so physical that you're not sure you can get through it, right? And then executing. That is what our student athletes do every day. And they're so good at it and have been driven towards it that we can study the ultimate execution of all those things. But then we can take them back to you and to my mom who needs to paint her house and to my patient who really just wants to continue swimming. And I have a patient who is 76 years old who swims 3 times a week. And she's a rock star. I just adore her. She just every day wants to be able to do the things that she's been doing for 25 years and enjoy them. And we can take all those lessons learned about that execution and bring them all the way down to the weekend warriors and make us all healthier.
Sure. I'll take that and think about that.
Yeah, you think of it. You're thinking about it all the time. That's right.
26-mile journey. So we know about sports medicine and treating injuries, performance, prevention, access. This partnership between BROC and Traction have played a huge role in advancing sports medicine here in Baton Rouge. How are we expanding our services into this community, especially for young athletes in schools? And how do those collaborations fit the bigger picture in care and performance?
Right. Let's talk about Traction first. I think it's very important that when we talk about athletic health and elite athleticism, that we don't forget that kids need to play. They need to play with each other so that they learn great social skills. We all need to be good human beings, right? And healthy human beings. And that starts when we're young and we learn how to play in groups. We learn how to push ourselves individually. People learn so much from the beginning years of their sports experience. And the vast majority of those students will never go on to play anything, even high school sports, if they're lucky. But group sports is a great way to maintain your mental health and to maintain your physical health so that you can be an older adult. That is why we partner with Traction, because Traction is in the community every day, encouraging kids to just have a good time. Play with your friends. Enjoy being outside. Get off your screen. Burn a little energy off, right? Make yourself a better person. And they do it so well, and they're so great at motivating young kids to do that. We knew that we needed to get all the way at the deeper part of the community, which is our North Baton Rouge focus. Not having enough access to sports hurts kids. And how do we take something that's so great like Traction and then say, can you help us in North Baton Rouge where our kids should be playing in safe places, and they're not. Yeah. And so providing that kind of access and with such a willing team who thinks that, sports are going to pull you out of a lot of things in life that because those best buds you're playing with, they're going to pull you out of a lot of things in life. That's what playing sports is all about. And that Traction partnership is so important because of that.
Caveat to that.
Yeah.
I have a daughter, 11, son 5, and daughter 5 as well. She just made 5 again.
Yeah.
How do you feel about, playing multiple sports in the development of a child, not just sticking to one specific sport?
That's a great question. Number one, I learned a lot of this from Mac Twilley, who is the CEO of Traction. He actually has now we have it in all of our pediatric clinics, sort of what sports should your children play as they're getting older. He talks about not playing individual sports till later. You have to learn how to get along with human beings before you learn how to push yourself individually. Otherwise, you're just going to be a spoiled kid, right? If you're always just focused on yourself, that's not good for you, not good for you in the community. So group sports first. We've paired that with our vaccine chart just because it's easy to say like, hey, when you go to the doctor, are your kids playing these kinds of sports? It's healthy for them. Mac also talks about being a well-rounded individual. There's 2 reasons why that's the case. You got to try a lot of things. You should never pigeonhole yourself early in life. But most importantly, overuse injuries are the most common reason that young children have injuries. Every once in a while there's a break or a fall, but most of the time it's an overuse injury because you keep doing the same thing with the same body part. When you play multiple sports, you don't have as many overuse injuries. There's a great book, last name is Epstein. David Epstein wrote The Sports Gene. And in that book, he talks about great athletes who were more well-rounded early. And he followed that book up with a book called Range. Both of them are exceptional books. But in Range, he talks about how if you have a wide range of talents, whether it's in sports or even in medicine, he talks about people who are driven too quickly to specialize. You don't get the whole picture. When you don't get the whole picture, you never get as far. So playing multiple sports decreases overuse injuries and actually makes you a more well-rounded elite athlete. But that's not what parents want to do these days, right? They want to pick and go, and that's what society's pulling us towards. So we have to fight it. Yeah. We have to put out the information, say your kid's going to have less injuries if they do this. Pick a couple sports. Don't become dedicated, Max says, until the age of 11 to 13. Until then, they should play multiple sports a year, and they're going to go far. Roger Federer never played tennis until he was in high school. Never. Not one single time. He never played elite tennis until he was in high school. He played table tennis, but he didn't play on a team.
What other sports did you play?
All sorts of sports. He loved sports. But his parents were tennis teachers, and he bucked the system like all kids do, right? Like your kids are probably doing it to you too.
Yes.
And so he said, I'm not playing tennis. I'll never be a tennis player. And then at some point in high school, he gave in and picked up a racket. But I'll tell you, if you talk to every tennis coach, they're going to tell you, oh, no, you got to start playing early. Nobody makes it in tennis unless they play early. But that's not the truth, right? So I think that to get back to your question, kids should play lots of different sports, try lots of different things out, and meet lots of different people because that's what makes them happy.
For sure.
Yeah.
Thank you.
Absolutely.
Take that one home.
Good luck.
I need it. So tell me about how you are continuing to partner with BROC.
Oh, right. So we talked about our Traction partnership, but these things kind of come hand in hand. We talked about how Traction is getting us deeper into youth sports and how that's going to help the community. We really have to bring in the fact that athletes just get injured, right? And when they get injured, they want to be back active, playing as fast as possible, and that's where BROC comes in, right? We have the most exceptional orthopedic physicians in this town. We're really lucky. I don't know how we got this lucky. I think it's because people from Louisiana want to move home, thank goodness, because when you look at the collection of people who focus on the foot and ankle, people who focus on the hand, people who focus on the shoulder, BROC has it all. Their sports medicine physicians focus on everything. And I've sent so many of my family members over the last couple of years to see a BROC orthopedist. And the level of care they provide, the level of follow-up, and really their focus, whether you're an elite athlete or whether you are a grandparent just trying to, continue to sew the way you want to, they want to make sure that you get back to where you want to be. We are really lucky to have them. So one of the things that we have partnered with lately is now BROC's going to be on our Lady of the Lake campus in a clinic for our patients there, which is awesome. That opens in January. We're so excited about it. And then when we build this new clinic next to the arena, we will have BROC, we'll have Traction, we'll have performance, we'll have athletic training, we'll have nutrition, everything that an athlete can have in one place, and that will definitely involve our BROC partners.
We mentioned athletics, especially the event at RMC a couple weeks ago, which I thoroughly enjoyed by just being there. One of the providers there, he spoke about essentially what you're saying about he was an athlete. I believe he was at LSU.
He was a football player.
And he decided to go into medicine.
Yeah.
So it seems like that trajectory kind of happens often. What do you say to those athletes or just people thinking about getting into sports medicine while they're in school, whether they're continuing to play and kind of balancing that whole thing, which seems very difficult to do? What is your advice to them?
Right. If you want to find somebody who's going to get something done for you, you find the busiest person, right? You don't find somebody with a lot of time on their hands. That's what I think about with student athletes. They are so busy, but they know how to add new things to their schedule because they're very dedicated to their task. So I think from a student athlete perspective, it doesn't matter if it's a high school kid is playing, year-round baseball, which may not be the best for them, but they're doing it anyway. They can always find time to volunteer, to shadow a doc, a psychologist, a respiratory therapist, a physical therapist. It doesn't take much to put your foot in and say, do I like this? Is this for me? A lot of kids end up gravitating towards somebody they've seen. So I think we heard that the physician who spoke to us talk about how he had been taken care of by orthopedic surgeons, so he felt like that's what he needed to do. But we want to make sure that in the course of your college years, for sure, and even in high school, that you're exposed to careers you may not know exist, like sports counseling, sports performance, really interesting people who get to spend a lot of time around the profession, but are really focusing more on how do you deal with all of this and still keep your game up. That's a fascinating career. I also think registered dietitians who focus on the health of an athlete, it's just fascinating to me. How do you fuel? When do you fuel? How much do you burn? It's very individualized. But we don't promote registered dietitians as much as we should. And it's a great career, right? You do fun things. You can have a family. It's a regular amount of school. Like we really have to get all of our kids, and including our student athletes, more exposed to these. And that's what we did at the hospital. It was super fun.
It was super fun. I thoroughly enjoyed it. Some things I just didn't think they were even there.
What'd you learn about?
oh my God, they were like the dummies in the and they were doing the chest compressions, the blood work, also the dummy laying down, and they were I forgot the name of the tool. I'm not
right. No, they were using like a bronchoscope, and they were looking inside their trachea and learning how to intubate. Yeah, the simulation labs are so cool.
Simulation lab, yeah.
You don't have to feel uncomfortable. The first time you walk into a patient room, I remember that there were no simulation labs. What did you tell me at 20 plus years earlier? Yeah, there were no simulation labs when I trained. And so it's uncomfortable to walk up to a human and say like, hey, I'm going to do something to you. And I don't really know. You don't tell them. I'll do this to you. Pretend that I've done it before. And so the sim lab gives us a lot more experience than we used to have before we see our first patient. And that's great.
Yeah, even the part where like the fake blood of one, let's say, nursing student, she tried to use it and it got everywhere. I was like, oh, wow.
It happens.
Thank God this happened on a dummy.
That's right.
And not
it happens sometimes in real life too. Did you go to the lab?
I did go to the lab.
Yeah. Medical lab scientists are really, really cool. A lot of investigation goes on down there.
It seems like a connection between all of the parts, right?
Yes.
Like the communication between two. I was kind of impressed by that part.
Yeah. I spend a lot of time in the lab. We have some head scratcher patients, right? That come in really sick and we can't figure it out. And that's when you go down there and you gather all your resources. And it really is a team, like athletics. Everything about healthcare is still working in a team. And they help out a lot. I love that career.
I admired the joy they were walking around with. I don't know if it was because I had a camera and but
they were so excited you were there, right?
They were like happy to be there.
They are happy.
It's like, okay, you enjoy your job.
They do get things for people, and I think they feel super connected to the patient, even though they don't see patients daily. They're a joyful group. I find in the hospital, you will find a lot of joy in people because they spend most of their day giving back. It's a really cool part of medicine we don't talk about a lot. But you'll see it every day when you walk in. And that's why it's important to take the students there.
For sure. Yeah. Speaking of joy, one of our personalities for our brand is joyfulness. And of course, joyfulness of spirit is one of our core values. What brings you joy on days like this?
Well, it's kind of cold. We walked in with Aaron Cox today, and he's from up north, so he doesn't think it's cold. I think it's kind of cold. What would bring me joy today is if it was 10 degrees warmer and I could work out in my garden. And maybe I will at some point, but that's what brings me joy. I love being outside. I love running. My knees aren't as good as they used to be, but I do love to run. But I love to work in the dirt. I love to grow things. I like to see things made and happen, right? So we have this farm you talked about earlier. We have a big garden, a lot of fruit trees. And man, it just gives me so much peace to be out there just whittling away at stuff.
Well, looking ahead, what excites you most about the new sports medicine facility here on LSU's campus and the broader vision it represents?
Man, that's one of the most exciting projects we've had in a long time. I think putting together all the pieces we talked about, having access for kids who are just getting into sports and need to know how to stay healthy and enjoy doing it, right? It's going to be a great, fun place for kids to interact in a good way with sports medicine. I really worry about our aging population and how little we move and how much time we spend on the couch, right? And for those people who are motivated and say, I want to continue to move, how do we keep them healthy in our community? This is going to be a great place for our weekend warriors, for your average gardener to say, hey, I need to keep my edge up because I want to do things. I want to get on the floor with my grandkids and stand up without holding on to something. That is a problem that we can help fix. And so this is a place for everybody to come and get the most out of their life. And it's going to be fun and exciting because it's going to be in the heart of Baton Rouge on campus. And that's what motivates me every day is making it a great place for people to seek care because I know they'll be healthier.
Sports medicine has been around for quite some time. Are we learning anything new?
Yeah, I think that one of the important things that we haven't talked about today is the Institute for the Health and Performance of Champions. So most people have some sort of sports medicine institute in their town, right? Somebody who's going to say, hey, this is the mecca of where you need to come to see a doctor and get better. The difference between and what differentiates us from all of these other institutes is our partnership with the research element on campus. When you look at what are we learning from these athletes, I think you asked me that earlier too. There are so many things to learn that are not on the surface. So if you walk into the kinesiology lab right now, there's a study going on with older LSU athletes. we know at some point in their young life, they hit their peak performance, right? And so now we're asking them a series of questions about how did that affect their health long term? How did it affect their mental health? And then we are testing them. We test their white blood cells. We test them on a treadmill and a bike. We look at how they metabolize their calories versus people who have never functioned at an elite level. And man, you see some rock stars still. I mean, whether you're in your 50s, 60s, or 70s, having performed at an elite level when you're younger keeps your body able to bring that same energy again. What's super interesting, though, is that we can then look at how they metabolize. And this goes back to how do we help the community stay healthier longer? If we can prove in a lab that having reached peak performance early means that you can continue to reach peak performance and keep from getting diabetes and keep from getting heart disease, then we can really encourage youth sports as a way to stay healthy lifelong. That's the kind of thing that this institute brings that we wouldn't have as a health system without them. We don't have a research lab that puts people on a bike for a couple of hours and really pushes them and then studies their white blood cells, right? That happens on campus. But the partnership is what brings the answers to things that I can take into the clinic and really educate patients on to the right people at the right time. So excited about that partnership, so excited about what it's going to bring to our community. That's how we make our community better. Our community doesn't know the power of this partnership, but they're going to see it over the next 10 years. I can't wait.
Here we do all things with great love. What's something you've recently seen that's made you feel the heart of FMOL Health?
The heart of FMOL, the heart of each one of our hospitals in our hospital system is really deep inside of it. And I hate that people can't see it more. I mean, when I feel our mission the most is when I'm watching people interact with patients and watching patients' families interact with each other. When you watch people help each other out and you see how we really do love human beings, you sort of forget about all the noise outside. There's so much that comes at us, so much pressure we talked about earlier as we were walking in life. But if you're just immersed in patient care, I'll tell you, yesterday I saw this patient who has a terrible cancer in her neck. And she's so lucky to have met our head and neck surgeons, and they've done some amazing things to remove her cancer, but she's going through a long process of healing. Lots going on. And watching her husband and she interact in the room was beautiful. He's become her caregiver, even though he was not a caregiver before this, right? And then watching her walk out of my clinic, everybody telling her bye. She knows my clinic nurses. It's a joyful encounter for everybody involved because we're just focused on making people better. So I see it every day at work. It's what motivates me to come to work, what motivates me to put more places that our health system can support the community in. Because healthcare is wonderful, but working for FMOL really makes it joyful. And I hope that more people get to experience that.
Is there anything else you would like to share for the public to know?
You know, I think we can do this. I do. This sports medicine journey is really a community journey. Thanks for having me here today. Thanks for talking about sports medicine. Our community needs to know that we can be healthy and we can be awesome just like our sports teams, that our community itself can be. And I think sports is just giving us a glimpse of all of the different things we can be. We can have the best education. We can have the best healthcare. We can have the best sports team. We can do this. And I hope that everybody in the community feels it because I think it's happening around us, and I'm just so excited about it.
Thank you again for joining us, Dr. O'Neill. To our viewers and listeners, thanks for tuning in. We'll have helpful resources linked in the show notes. We'll be back soon with more episodes of Straight from the Source, a podcast from FMOL Health. If you have ideas for topics you'd like to hear on the show, email us at podcast@fmolhs.org.